The second nurse to contract Ebola was on a commercial flight halfway across the country. The night before, she reported her symptoms to the hospital, but she apparently flew while she had a fever. Now the CDC says it's moving to restrict healthcare workers who care for Ebola patients from taking public transportation. NBC's Tom Costello covering that end of the story for us. He's at Reagan National Airport in Washington.
Brian, the fact that the second nurse knew she had a low-grade fever before boarding the flight has a lot of people concerned and questioning whether it's time for more travel restrictions, even for domestic flights. On the ground in Cleveland today, after 2 thorough cleanings, the Frontier Airlines plane that carried nurse Amber Vinson from Cleveland to Dallas Monday night. That same plane went through a routine cleaning that night before returning to Cleveland the next day and flying routes to Fort Lauderdale and Atlanta. Today, the CDC director said healthcare workers who care for Ebola patients should not be traveling.
We will, from this moment forward, ensure that no other individual who is being monitored for exposure undergoes travel.
While the CDC insists the risk to other passengers on board the plane is very low, it is reaching out to all 132 passengers to answer questions and arrange any potential care. In Cleveland today, healthcare authorities insisted the airport and the city are clean.
We're taking the advanced precautionary measures to decontaminate, to ensure from an infectious control perspective that we are making sure our public is safe.
Meanwhile, tomorrow, 4 more international airports in addition to JFK, Newark, Washington, Dulles, Chicago, and Atlanta will begin screening passengers from West Africa for any signs of Ebola, taking their temperatures and inquiring about their health. A former U.S. Surgeon General says it's time for a serious discussion about restricting travel from West Africa.
We need thoughtful leaders to sit down and say, is it worthwhile to consider a travel restriction now? If so, how do we execute on that? What's the expected benefit? And what are the unintended consequences?
Much like the Homeland Security watch list, the CDC has its own do not board list, which is really pertaining only to people who are thought to pose a risk to the public health. It is enforced by the TSA and the Customs and Border Patrol, and it only applies to planes, not buses or trains. Brian?
All right, Tom Costello, National Airport in D.C. tonight. Tom, thanks.